Obamacare will help you start your medical billing business in 2013. Patrick and I are going to go through a lot of different information this afternoon concerning Obamacare, or what we know as the Affordable Care Act, and some other very important issues that are going on and that will be affecting these doctors come 2014. So hopefully you've got your pen and paper out. You've got some time where you might even want to jot down some questions as we kind of go through it. Again, I'm just going to introduce myself one more time. My name's Eric Auger. I'm the Director of Research and Development here at American Business Systems. And also want to let you know about, want to make sure that your hearing is okay. There are a lot of people that have been on our webinars for many times here in the past, but for those that are first timers, we ask that you raise your hand. So we've kind of pointed out right here, this little icon of a hand right there, so that it at least lets us know that when you click on that hand, our voices are coming through in a good fashion. So far I see no hands going up. Oh, here we go. All right, Larry, Glenn, thank you. Minerva, thank you so much. Okay, so now that we are ensured that our voices are going out clear, that's a big help. And so, but again, let me introduce some of those others that are actually on the call today. Glenn, good to have you here. John, Veta, Gangadar, good to have you. Antonio, good to have you here as well as you're arriving here. So we just want to, again, make sure that we're all coming loud and clear to you. Also, during the webinar, there's going to be an opportunity right down in here for you to ask some questions. So we want you to be able to type in your questions. Patrick and I will see them as they come up, and we'll answer those accordingly into whatever section that we might be in to make sure that we're sort of staying on track there. But if by chance we don't get your question answered, we certainly will get that taken care of even after the webinar. All right, for those that have never been on one of our webinars, we want to take a little bit of time to tell you who we are. Who is American Business Systems? Well, first of all, let me tell you, we're a company that's been around going on 20 years in about 2 more weeks. Folks like to do business with folks that have been in business for quite some time, and we are fast approaching our 20-year mark. So we know what we're doing. This is all that we do. We help folks like you see here in this picture and have been for the past 20 years of helping people get started in their own business in medical billing. And we do get asked sometimes, well, what other business opportunities do you sell? There is no other business opportunity that we sell. Medical billing is the only thing that we do. And we do it because we have some proprietary information or proprietary software that allows us and those, as you saw in the previous picture, to do billing from wherever they're located, whether they're at home or they're in an office building, on the road, if they've got internet access, and in whatever platform you want it to do, whether it's on a Mac or whether it's on a PC, an Android tablet, or an Apple iPad type of tablet. So we're ready and geared for the future. If you haven't been out to our website yet, we want to encourage you to go out there on our website. It's absystems.com. We've got a lot of information just on our website. You can start it right here where it says talking about us and the business package, the income potential, the news, and this news is updated all the time. It's our blog, and Adam Phillips, our president of our company, does a great job of making sure that we are all updated with the latest news in medical billing. But to get to know more about the business opportunity, you're going to want to click on these orange buttons here, either this one where it says request more information, or right here where it says get started, and that will get you into what's called our virtual brochure. And many of you kind of started in some of the virtual brochure, and what we've kind of noticed is that you get through the first or second go round there, maybe through the opportunity, getting clients and training, but folks, there is so much information that you need to complete to help you truly understand the full line of the business. So we encourage you to go through everything through the opportunity, all the way through technology, and finally to the final steps there. And you'll see all the aspects of the business. And you're really going to want to know as much of this even on your own personal due diligence. And we do get asked quite often about what is our rating with the Better Business Bureau. Well, for the last, gosh, as far as I can remember, we've had an A+ rating with the Better Business Bureau right here in the Fort Worth area. We have several people like to come by and visit us. Matter of fact, we had a gentleman last week visit us at our training class. We've got I believe, a partnership coming by tomorrow at our corporate office here at 5751 Kroger Drive. We're in Keller, Texas, which is just a little suburb north of Fort Worth. We'd love for you to come by and join and visit us and just have a kneecap to kneecap meeting, if you'd like to, so to say. Folks, we just got through with our training class last week. That was the last one that we had for 2013, and it was a success. There's no doubt about it. We had a great group of people. They left out of there so charged and ready to go. Matter of fact, I've heard from a couple of people already who are already engaged with doctors, dealing with their issues and some of the issues that we're going to be talking about today. But if you're looking to get started in this business, 2014 is really one of the key years, and no better way to get started than starting with us here in January the 20th through the 24th. It's 5 days of live training, and I really emphasize live training because we don't just do it over the internet. Although we have a lot of information on the internet, you need to know about what to do and have that dynamic of being in a live class. Matter of fact, for those that are attending in the January class, we're going to talk a little bit more about this towards the end, but because it's a 20th year anniversary, we are giving out a free iPad mini. And so we'll tell you how that you can get a hold of one of those when you attend that January training. Let me introduce Patrick to you. Patrick and his wife Linda actually started this business again over 20 years ago. They've been in medical billing for 20 plus years. He is an author, has written not only just these 2 books, but have been as an author in other books and co-author on other books. But these 2 are very important to us here at ABS. The one on the left-hand side is How to Reprogram Yourself for Success. It's just not just a little book on just self-help there. It truly is to help you get that new mindset of what you need to do to get prepared for this particular business. And then the book on the right, Cash Crunch to Cash Flow. Folks, this is basically your Bible and your introduction into medical billing and what it means to be a revenue cycle management company, not just a billing company. So either of these books can be found on Amazon.com, or ask your ABS rep, maybe see how about getting a copy for yourself. Patrick is also an author in many magazines and has been featured on several over the last, I'd say the last 6-8 months. We've been requested from this one called Billing and Coding Advantage magazine. Patrick's already written several articles of that, and now he's one of the top headline articles that were written, how doctors can cut their billing costs up to 50%. And truly, if you could see right up in this section right here, that's where that article is being highlighted. And so Patrick has been very busy working directly with Billing and Coding Advantage magazine and some of these other magazines. And folks, and again, if you'd like to see about getting a copy of that article, please let us know, and we certainly will help you out there and see about getting you a copy of that now. All right, let's bring the guy on. Patrick, come on, visit with us this afternoon. I know that you're a busy guy and you're taking out your valuable time, but let's get started here on, let's first ask the question. Patrick, is medical billing a viable career choice?
Yes, it is. Well, thanks for being on here today. That's the answer to that question.
Just that easy.
It's just that easy. That's right. Well, actually, it's a viable choice for people, Eric, but because of what we're going to talk about today. I mean, people sometimes are concerned about, they hear about Obamacare and the new, what's referred to as the Affordable Care Act, and they're wondering how that affects, the whole thing. So to ask that question is basically to answer it like this. The ACA, Obamacare, is going to be one of the biggest reasons why people should get into medical billing. And I think maybe I'm pushing a button here, and you are too. I'm not sure.
Oh no, I'm not touching anything. I'm just
okay.
Go right ahead. You got it.
All right. Well, let's talk about that then, because doctors don't just hand their cash flow over to just anyone. That should be obvious. In fact, if you folks who are listening to this webinar went to your relatives or friends and said, I'm thinking about getting into medical billing, doing the billing for doctors, they would probably ask you, why would doctors need you? I mean, can't they do it themselves? But in effect, Eric, you're the one that actually brought this up, I think, in one of our previous webinars, that physicians actually
Exactly.
run two businesses, right?
Yeah, exactly. I mean, if you think about it, is that they are in the business of seeing patients, and then as you think about how medical billing has grown and all the new nuances to that, um, that's why so many people are actually getting into medical billing. So if you think about it, physicians, if they're doing it in-house, they're actually trying to run two businesses at the same time. One to see their patients, and then the other to just administratively run a medical billing practice there. And so this is what's really making it really appealing. I think Patrick, you and I were talking about this because we were talking about different slides. This is kind of equivalates to our understanding. I think you kind of brought this up when the tax e-filing came about, where it was supposed to let individuals like all of us be able to quote unquote file our own taxes easily.
Right.
It's not that easy.
No.
I think we're seeing more of H&R blocks around the corners and Liberty Tax, services.
Yeah.
These things are popping up all over the place. This is the equivalent to how things are in medicine for the doctors when we're doing the medical billing.
Yeah, because even though the Affordable Care Act was meant to make everything run smoother and easier in the medical healthcare field, uh, doctors don't see it that way at all. Remember, put yourself in a doctor's mindset. They're going to college, they're studying all about the human body and all the parts and all the terminology and so forth. And then they get out and open a practice or go to work for some hospital, and they realize at some point, wait a minute, there's a lot of paperwork here that I didn't realize was here. They never dreamed that they would be dealing with Medicare and Medicaid and all the insurance companies trying to get their money. I mean, they earn their money by seeing the patient, but then they don't get paid until those entities send them a check, because very few
Correct.
people, of course, are self-pay. So that's why with the Affordable Care Act, folks, there's going to be what is it, 30 million more uninsured Americans that will be moving into the healthcare system, seeing those doctors. And those
Right.
doctors are going to be overwhelmed. They are going to need the help from medical billers more than ever.
So let's start asking the question, and because I think that's what we try to do today is pose some questions. And again, I want to remind everybody that you can type in your own questions, and we'll see what we can do to work those in. But Patrick, what does the future hold for medical billing companies? I mean, you've been sort of courted here lately by some of these high-level billing and coding magazines, and they're actually turning to you to answer some of these questions. So really, what does the medical billing future companies hold? I mean,
I,
what's
I
going on?
think that's because we've been around, again, like you said, Eric, for 20 years, and they recognize that we've been dealing with this whole industry with doctors through dozens of people from coast to coast that have gotten into this business of medical billing. And so when the Patient Protection and Affordable Care Act, the PPACA, are sometimes referred to as Obamacare, is fully in effect starting next year. I mean, within a couple of 3 weeks, it's going to
Right.
be in effect. And when it does come into effect, of course, it's going to affect all the doctors and everybody that's in this industry. So the real question is, what does the future hold for not just the doctors themselves, but the people who are doing the billing for the doctors? So let's start out with just the vitals. Here's the basics that you can get off of the government website here. Uh, 30 million newly insured Americans will be in the healthcare system soon. 32% will gain coverage from Medicaid, and 45% from the individual exchanges, they're called, which are just different ways of getting your insurance from private insurance companies. And then 23% of the population, of course, will get their insurance from their employers. But the point is, it's going to be big, big, big. And things like this always bring opportunity. You found this, Eric. Why don't you read this quote here from Martin Willoughby?
Yeah, Martin Willoughby is just a serial entrepreneur. I mean, he's as you can see there, he is a business consultant. Has written the book Zoom Entrepreneur. So this guy's kind of, he's got his pulse on everything that's going on, and we literally found this quote from him just a few weeks ago. He says, regardless of what happens with Obamacare, And that's what we've got to kind of think about, Patrick. Regardless of what happens with Obamacare,
Right.
there are going to certainly be opportunities. But he goes on and says, I hope that you will seize this opportunity to expand your thinking to embrace the changes in the profession and find creative ways to seize the opportunity that comes along with change. You certainly go out to his website, you'll see that out there, and that's what's making it exciting for us, because we get a lot of questions asked about the future of medical billing because of Obamacare. And Patrick, I think during the summertime you actually talked about disruption and how that is a business term of, when we're talking business. And again, I came across this Clayton Christensen Institute for Disruptive Innovation. These are some of the big points that they're bringing out. So Patrick, I'm going to let this one fall under your lap, because this is what you like to talk about.
Yeah, I love the name of their website there, the Christensen Institute for Disruptive Innovation.
Mm-hmm.
I mean, it can be a positive thing, right? Because disruption means things are going to change in any industry. You guys look at what's happening right out there on the social media, for example, right now. I mean, a site is here one day and the next day it's not there. It's because that is what this life is all about right now. It's change. And even though most people don't like change, those people who embrace it and get involved in that industry will find there are opportunities, because when things change, they say there are opportunities out there. All you have to do is look for them. We happen to have found those opportunities and are sharing that with our licensees. So entrepreneurs, people who start their own businesses, seize the opportunities. That's what makes them entrepreneurs. Here's a quote from that site.
I was going to say, you got some quotes right directly from here. Why don't you take those, Patrick?
Throughout history, disruptive innovations have repeatedly and often predictably transformed entire industries through the introduction of affordable and accessible products and services. Isn't that amazing that they actually use the word affordable? Because
right.
That's what the Affordable Care Act is supposed to do: give more access to more people to the products and services in the healthcare industry.
Now, Patrick, point out that this is an article from them. It says this quote's coming from this article that was written September of this year, 2013. Seize the ACA. That's what we're talking about here.
Yeah, they're specifically talking about the Affordable Care Act and saying this is the reason why it can be a good thing for people who do get involved in it. Let's give an example of that, Eric. Let's talk about Tierney Martins. Now, Tierney is an ABS. Tierney's an ABS licensee out in California, and my wife and I actually were visiting in California and stopped by her office. That she's standing right there by her office there, and in fact, she started back in September of 2008, Eric. And at the time we were out there and met with her, she only had about 6 doctors, which is a good number of doctors. You can make a 6-figure income with 6 doctors, right? But now she has over 50 doctors. And in fact, she just bought, get this, Eric, this 6,000 square foot office I'm talking about here is an old hotel there in her town. She bought the whole building. And of course, she's going to office in it and then renovate it for leasing out other offices.
Yeah, this just presents to those that are on the call today. You can see now. Let's just set the stage of who Tierney Martins is. When she first came to us, she was a housewife with married, 2 children.
Mm-hmm.
Her husband is in the construction business there in California. She came to us saying, "Hey, I need another avenue to help my husband make ends meet." And I think she's done that. And folks, I think someone asked me yesterday on a call, what's our responsibility when we get into this business? What is our responsibility, folks? It's going out there and finding the doctors that need help. And you can clearly see that with just a little bit of the assistance that we do truly give you through American Business Systems, here is Tierney that has just blown the door.
Perfect example. Yeah. By the way, I'm going to interview her on Friday for our licensee base. This is a webinar specifically for ABS licensees, but we're going to take parts of that and create a blog entry. So all of you on the webinar today will be able to see that entry where I interviewed her probably sometimes next week. once we get past Christmas, probably.
There you go.
Okay, so we came up with this little chart to kind of summarize what the ACA is going to do for the revenue cycle. That is inside of a doctor's office. How will it affect his revenue, his income? And the way it starts out, of course, is up here at the top. There are going to definitely be more patients, as we'll see here from some quotes in just a moment. More patients coming in to see the doctors, more visits to the doctor by the current patients because they will have full coverage of help their health care. That will generate more claims, and of course that's a good thing because that brings in more revenue for the doctor. It also provides more billing for you as a medical biller and more profits for you and the doctor. That also frees up the doctor since he's not having to mess and his staff is not having to mess with the billing. You're doing it for him. That frees him up to see even more patients. You see how it's a great thing for this whole healthcare industry.
Well, let's look at some of the current things that we're hearing about. Will there be more patients under Obamacare? That's a question that we sort of need to sort of ask.
Yeah, and Eric, you, of course, as the director of research and development, have found a lot of great things out there that are just, fairly recent. This was back in September.
Right.
This is a headline article on Bloomberg. Doctors brace for the health law's surge of ailing patients. In other words, the doctors realize that they're now going to have to see more patients. Now, folks, think that through. If the doctor and their staff have to see more patients, will they have any more time or will they have less time to deal with the billing? Obviously, they need to focus on their core competency, which is seeing patients and helping them to get well. And it's going to be the waiting rooms will be crowded. Here's another article from Fox News. This was just October 1st. Physicians prepare to deal with increased demand and strain on their practices under Obamacare. Now, folks, if that's not good news for people who are looking at getting into the medical billing business, I don't know what is. The
Right.
physicians are realizing themselves that there's going to be a strain on their practice under Obamacare.
Yeah, and let's. I know we don't have a slide for this. I know we've talked about this in other webinars, Patrick. But what it costs a doctor to outsource their billing is going to be roughly anywhere from $30,000 to $35,000 a year. That's sort of the kind of the rule of thumb there, and we can certainly point you in the directions to go listen to those other webinars to see that. But what does it cost a doctor to actually employ another person, and then the added things that go along with that? Well, that's way over that mark there. I think we've kind of marked it out. It's right around $60,000 to $70,000 just for that doctor to hire a new person to actually do billing in their office. So, when we have doctors that come up to us and says, "Oh, I can do my billing for like 3 or 4%," they are not looking at the entire business arena of what's going on within their own office there. So we could start off just asking the question, how much do you pay your person a year? That in and of itself is usually more, costing the doctor more than if they had it outsourced. And because of this increase of patients that they're going to be faced with, doctors are literally looking for outsourcing. I mean, Patrick, we ran across this last week with a doctor that actually called us.
Yes, tell them that story. That's a great story, Eric.
It's unbelievable. We Adam, our president of the company, actually had to take one of his children to the doctor, and Adam certainly didn't go over there to promote anything about ABS or medical billing or anything. But the doctor just sort of I think he kind of just came out and said, "Well, I just don't really like what I'm using." Adam kind of had a quick little dialogue with him. Long story short, we ended up having a meeting with him this last Monday. And Patrick, the first thing that this guy told me was this: "Eric, if you guys can't help me and help me save my practice, I'm quitting medicine." That was his
Wow.
first words to me.
Wow. To a total stranger, basically.
To a
He didn't
total
know you.
stranger,
Yeah.
a completely total stranger. You're correct.
And we've had stories from licensees, folks, that have said, this practice was about to go under. I came in, solved their problem, increased their revenue, cut down on their rejection rates on the claims, and salvaged that practice. And the doctor will tell you that himself. They've become very close friends with some of those doctors because of that. You can imagine.
Exactly. All right. Well, let's talk about how Obamacare is going to position you as a medical billing company for huge profits. And I think, Patrick, let's show them the next slide here because let's don't take our word for it. Go do
Yeah.
your research. And
Yeah.
right here, under this PRN funding, this is a funding company. Patrick, let's. I'm going to turn this over to you.
Yeah, oh, I think I pushed a button I shouldn't have there. Okay, so you guys can go out to PRN funding, and you'll see that they actually have an article out there on medical billing and coding industry predicted to boom by 2020. Now, folks, that means that from now, 2013, 2014 almost, until 2020, in the next 6 years, this industry is going to boom. Why? Because as it says, while some industries are stagnant or losing steam in the slowly rebuilding economy, one industry is predicted to grow faster than any other. Just happens to be medical billing and health information. Folks, it doesn't get any clearer than that. This industry will increase faster than any other occupation at 21% by the year 2020. In other words, between now and 2020, 21% growth. Where do you hear that, Eric? In any industry,
Right.
food, building, construction, hotels, travel? No, it's only in this industry that we see that kind of growth. So that
Yeah.
means more profits for our licensees, of course.
Well, let's just, Patrick, we got savvy business people on the webinar today, and those that have just the slightest bit of business acumen. I think you can tell that we're just not blowing smoke here. I'm trying to get you involved with us at American Business Systems, folks. We're showing you what the industry leaders are telling us and telling you. I mean, that's a significant growth, and inside of there's we don't have this statistic up there either, but the just the healthcare industry in and of itself is 1/6 of the America's GDP. That's huge.
Yeah. And so I tell people, look, if you could look at that as a pie, all you need is a little thin slice that's so thin it's just a line, to make
Exactly.
a really, really good income from this industry. Look at this quote here. This is from Barron's. And they're
Barron's.
saying, I mean, look at the title up here in the top corner here, How to Profit from Obamacare. And within
Yeah.
this article, it says that 7 million Americans will seek benefits through these different marketplaces and so forth. And it's talking about now the insurance companies themselves. These companies can grow earnings 15% a year, even without the Medicaid expansion from the ACA.
Right.
In other words, insurance companies, folks, are positioned to grow on this thing and have bet on it. And in fact, one of the biggest supporters has been the insurance companies because they recognize that this has a huge future. Eric, the reason I bring that up is because you know that we've had people kind of a little concerned about, well, what if all the insurance companies go away and the government takes over the billing? So I thought
Right.
I would just address that with these types of quotes.
Yeah.
Here's one right here from this article. It says that the government-sponsored health plan for the poor is undergoing its biggest expansion since it was created in the 60s, providing an enormous boom for health insurers that specialize in Medicaid and Medicare. And that's some of the biggest ones that are out there, by the way.
Exactly.
The industry sees green. So here's we even came up with some charts here from look. It starts over here on the left. 2009 is when these charts go all the way up through July of this year. And look at this, folks. Here's Blue Cross Blue Shield. Look, you see the pattern here, don't you? It's an upward pattern. Now look at United Healthcare. These are their stock prices. Look how they've risen in the past just year. Aetna, Humana, it goes on and on. Look at them. They all go up. And the reason for that is because they recognize that this is going to give them that many more clients or customers for their individual healthcare plans.
Yeah, and they're pouring thousands of dollars into marketing. And so, folks, we don't think that there's going to be a single payer, but we wanted to throw this question in here because, again, we get this question asked a lot. What happens if the United States moves to a single payer system?
So,
Well, I
so,
think we have found some information to help us along with that.
so let's start with the definition from Wikipedia. Single payer healthcare is a system in which the government, rather than private insurers, pays for all healthcare costs. Pays for it now. Remember, doesn't matter who bills for it, the government's going to pay them, right?
Correct.
So single payer systems may contract for healthcare services from private organizations, as it is in Canada. We'll talk about Canada here in a moment also.
Right.
The term single payer thus not only describes the funding mechanism, referring to healthcare financed by a single public body from a single fund, and does not specify the type of delivery or for whom the doctors work. People have even brought up to us, Eric, about the fact, well, won't all the doctors go to work for the government? It doesn't matter. Somebody
Right.
still has to bill for each thing that the doctor does for each person who comes in the door. They're not just going to give them a lump sum of money and say, okay, here's your $50,000 a year. Just see as many people as you can see.
Right.
So that's why it's usually a mixed public-private system, which is what it will be here as Obamacare kicks in. And besides all that, if the government had wanted to get involved in medical billing, it would have done so in 1965. Now, here's a picture of President Johnson at the time signing a bill, July 30th, 1965. Can anybody on the webinar guess what bill he is signing right there that has to do with healthcare in the United States? Let's see if anybody types it in the question box, an answer to that question.
Let's see. This is your opportunity to here we
Oh,
go.
there it
John
is.
says Medicare. You
That's
got
right.
it.
That's right, John. And John, Medicare, as you know, obviously, is always referred to as a universal health care for Americans that are 65 and older. So when people say, well, look, are we moving into a universal health care system under Obamacare? Well, maybe. We don't know the future. All we know is that at the time that Medicare came in, the government was not interested in taking over the billing for the doctors. Somebody is still billing Medicare. It's either the doctor or their own staff in their own office or an outside billing source. So Eric did a little research here, and we captured the screenshot. He's looking for Canada and medical billing services, and came up with just dozens of sites in Canada. Now, why did we do that? Because Canada has always been referred to as a single payer, universal healthcare type system. So we went
Right.
out to the very first link on that page. I went too fast there, but there it is right there, CBM Medical Billing Services. They're in Canada. So you can see it right here. Ontario, Canada is where they're located. And when you go into the services, here's what they specialize in: billing, of course, to all of these different entities. In Canada, there's what, 10 different entities there. And third party billing even is done by these companies. So, folks, medical billers didn't go out of business. They began to boom in Canada when they moved to this system because it gave them that many more entities to bill. Then, Eric, you went out and found some things about the colleges up there too, huh?
Well, yeah, as I was doing my research there and trying to figure out, what's going on with our neighbors to the north, it, lo and behold, if I didn't find the academies, their trades, technical trade colleges there that give courses in medical billing, and it's just amazing. And here's the bottom half of that from because we couldn't fit everything on there on the screen, but here it is, medical billing courses, and this is in Canada. And so, folks, again, you can do your own research. I mean, it's out there. But what's really most impressive is really what we found with the Canada's Medical Association, and here it is. Here is their new in practice guide in 2012, and it talks to now this is actually talking to the doctors there in Canada, and I don't know if it says it in this one, but I remember reading in one of the others. Oh yeah, it says throughout your residency, you are taught to consider your patients first as your number one priority. Now again, they're talking to the doctors. Your work conditions as a resident has been negotiated for you, and your salary is stable and consistent, allowing you to focus on perfecting your skills and knowledge without worrying about billing. But once you finish residency and start your own practice, you will be faced with a new situation. Will be responsible for billing the Ministry of Health, and your staff will need to submit and reconcile those billings in order for you to get paid. Staying up to date with your billing schedule will be integral to your success with billing.
There you go. Now,
Folks, again, this is from their website.
and that's why, even in Canada, the doctors there who don't want to mess with that themselves turn to an outsourced solution, a medical billing company there that will do the billing for them. Folks, that's what this business is all about. You taking over and doing that which the doctor and his staff, number one, don't need to be messing with because they're not experts. And number two, they don't have the time because they're seeing patients. Then we found in this edition of Reagan's Healthcare Communication News. Now, this is just in August of this past year. 10 healthcare jobs most impacted by the Affordable Care Act. And here's the quote from that article. Healthcare support industries, especially medical doctors, medical records and billing companies, stand to greatly benefit from the ACA. Folks, billing companies stand to greatly benefit from the ACA, as potentially 30 million new patients will need healthcare services. They'll need someone to keep track of all their medical records and billing. In fact, the American Recovery and Reinvestment Act is commonly known as the stimulus bill in this industry, and it's already resulted in $19 billion push to electric medical records, a push that is set to increase and demand more professionals in this field. We'll talk about electronic health records here in just a moment, too.
So the bottom line is, everyone, the government doesn't want to get involved in billing. We've sort of proven that with Medicare because since 1965. But then on the other hand, those countries that are already with a single payer, so to say, they're telling their doctors it is truly up to them. Matter of fact, if you'll go back and research in that Canada Medical Association, you'll find out that there's an article in there, 2 doctors to how to choose a medical billing company if they don't want to do it themselves. So truly, the government's not going to get involved in billing. Just as much as the government doesn't get involved doing your own taxes. That should be clear enough for us as we go on. But then again, we were kind of talking about money earlier, of what it costs a doctor to do and complete their own paperwork, and we're talking at least a minimum of $83,000 to $84,000 a year just for them to do this. Now, this is actually going to increase because, go back to that one little section right there, Patrick, because of what's going on in that second paragraph, and we're going to talk about that here in just a moment, about upgrading to the ICD-10 coding system. Now, again, we're talking, this is what it is now. We're going to show you a stat here in just a minute of what it's going to cost a doctor when they are going into the ICD-10 and what the costs are going to be for those particular doctors. But again, we are positioned, and you as a medical billing company cannot be in a better position to really take advantage of the opportunity that's out there.
Yeah, this is just kind of a zero in on that quote about 83,000 a year on administrative costs. Folks, there's a lot of money spent by doctors to not just manage their office internally and the patients coming through, but the billing side is a very costly thing for doctors that you can alleviate some of that cost for them. So all this whole webinar really, Eric, if you think about it, is there a need for third-party billing? Now, I want to turn over here to the questions. Boy, they've had a bunch of them come in here. And, well, I love this quote here by Grace. She says, "My goal is to follow Tyranny's example." I like that. Good. Okay, let's see. I'm just going through those questions here just carefully to see if we've missed anything pertinent. Some people are just making some comments rather than questions. Okay, so we'll move on. But guys, we are going to look over there in the question box on a continual basis. So anything specific to what we're talking about here, just type it in. Okay, so Eric, this goes back to that whole question: is there a need for third-party billers in the United
Right.
States? Because again, the doctors could do it themselves. Many of them do, right? I
Hmm.
had a prospect write a note here to one of our people at the office and ask, well, why do the doctors need me when they can do it themselves? So we found this article here in the April issue of Medical Economics that talks specifically to this. Now, look at this, Eric. I love this quote. At no time in medical history, they're talking about the fact that we're moving into all these different changes here in 2014. Has there been a greater need for expertise, technology, compliance assistance, etc.? There is simply no entity in existence positioned to meet these needs better than the third party medical billing companies. I think I'm going to put that on my wall here. Don't you think that's a good quote?
Exactly. I mean, it's just, and folks, again, go do your research. Again, go back to this Medical Economics magazine, find that particular article that's in there about seizing the sequester or the sequester squeeze that's going on there, and you're going to find that this is what's happening. So again, when we say that we're all positioned to meet the needs better, we're not just joking here, and again, we're not just trying to say how good ABS is. I mean, those that are in the medical field, in the financial side of everything, is just poised to do very well.
Look at this continuing quote here. By leveraging their essential functionality with the potential value adds referred to above, the third party medical billing industry can not only be an essential cog, but can also ensure that the Medicare healthcare providers have the time and resources to concentrate on their real priority, providing healthcare to our aging population. So there you go. We just said that earlier. Doctors' core competency is seeing patients. That's what they need to focus on, and that's what third-party billing companies allow them to do. Now, we're members of the Healthcare Billing and Management Association that has a voice in Washington that meets regularly with those people directly connected to the healthcare and Medicare there in Washington. And they met recently with them in the summer, this past summer, and in their newsletter, they had this quote. I'm going to zoom in so you can see it, but I wanted to just see first who it's with. This is with John Blum, the Principal Deputy Administrator and Director for the Center for Medicare. This is the guy at the top. And look what he says. Perhaps most significant was a statement by Mr. Bloom made early in his response indicating that he felt that despite all of the push for coordinated care and bundled payments and shared savings, fee for service payments would be around for a long time. Now, folks, there's from the very top. The fee for service payments is what you will be billing for to get the doctor the money from those insurance companies and, of course, from Medicare itself. Now, Eric, let's talk about the electronic health records. You mentioned that earlier. That's pretty essential to meeting these ACA requirements for
Sure.
doctors, huh?
Right, and EHR stands for electronic health records, and this is what we have to look at and see as we're moving into 2014, who's actually certified meaningful use. There was a stage one requirement, and there was a stage two requirement in which we've already met, and I think we're going to show a couple of snapshots of our particular system today, but it is essential for the ACA.
Yeah. Now, first, let me go back to that previous picture because folks, we're showing here, of course, an iPad. This is a doctor actually using our system, just touching the different buttons that you see there that helps that doctor in his encounter with the patient. So, literally, while he's seeing the patient, he's holding the iPad in front of him and pushing these buttons that records all of that encounter with the patient and helps you as the medical biller to do your job faster and more efficiently and more accurately because people ask us, well, how do I figure out what codes go in and what to charge and so forth? The doctor is putting all that in. It's all tied into our cloud-based system so that when he gets finished seeing a patient, boom, on your system from any computer in the world that has internet connection, 24/7, you can access exactly what the doctor just did and said and charged that particular patient. And it's ready to do the billing behind the
In
scenes.
fact, and Patrick, that's why folks that come into this business, you don't necessarily need to have a coding certificate or anything else like that, because again, our system does this for you. And again, if you want to see that in a little bit more in depth, just ask us. We'll be happy to show you a demonstration of our system just to show you what we're talking about.
Yes, again, folks, ours is probably the most leading edge technology that's out there, and it's specifically, individually, privately branded for you as an ABS licensee. So you don't have any competition with this system that's out there. And like Eric said, the codes are all built into it. I think we have another screenshot somewhere showing that even the new upcoming codes, the ICD10 codes, they're called, that will be coming in October of 2014, are already built into our system. So you hear about all these courses that you can take learning about medical coding. Well, unless you want to specifically try to find a job in a doctor's office as a medical coder, you don't need that type of training because ours has it all in there, and the doctors are the ones that are putting the codes in for you, tied in with our EMR.
Yeah,
So
and
in
as we go, I was going to say this right here, Patrick. We couldn't stress this enough. 2014 is such a critical year for doctors and for medical billing companies, and it's just a grand opportunity uh, for for those that are getting into the business and those that are already in the business.
Yeah, in fact, here's a quote right here from affordablebillingSolutions.com on the internet. I thought it was a great quote. Medical billing would change drastically under the ACA in that insurance companies will be paying all or the bulk of the bill without individuals being responsible for payment. There will be an increase in the need for medical billing experts to handle the workload of more forms, more coding, etc. This also means more revenue for primary care doctors, internists, pediatricians, and geriatric physicians. College students with no specified major are considering a career in medical billing, while older residents are considering midlife career changes. Eric, we've actually seen that happen, haven't we? We have.
Yes.
I won't use the word older in relationship to Dr. Combest, but we have a doctor who's our medical director, our senior medical director of ABS. She is in medical practice right now still, and yet she purchased a license and has become a licensee. Why? Because she wants out of the clinical side of medicine into what she calls the money side of medicine.
Right.
And then here's another quote from Harold Gibson on mscribe.com. He says, payers also face new operating rules for claims processing, including eligibility determination, which could further burden the billing staff and the practice managers. Critics believe the new rules will only increase the expense and confusion that result in billing errors and force the claims resubmission. Eric, let's talk about eligibility and our system.
Oh, wow. Yeah, that's pretty important for doctors to make sure. This is the best way I can put it like this way is before you get my services, how can I guarantee that you're going to be able to pay me? This is what eligibility determination really is all about. And with our system, we're literally able to go through our system and stay within our system and check the patient's insurance eligibility directly in our system and let us know, and also let the doctor know that that insurance is good. So when we go to bill for that, then we know that we're going to get that doctor paid. Right now, I kind of described this to a couple of guys I was showing the demo with. I think it was yesterday. It's imagine driving down the road without a dashboard. You don't know how fast you're going. You don't know if you're full tank or an empty tank. This is what doctors are faced with when they don't check eligibility. They're literally going through their practice blinded. They don't know what's on, whether their tank is full or empty.
Because they're seeing patients without knowing for sure that they're actually going to get reimbursed for
That's
the visit.
correct.
Yeah.
That's
And
critical.
ours has all that built into it, of course.
Exactly.
Now, you mentioned the ICD-10 codes that are coming here in 2014. Folks, if you're not sure about that, just do a little Googling about that, and you'll see that that's a big deal. In fact, the codes that are being used by doctors now for their diagnosis codes are they're going to be increased tenfold with these new codes. So even though there's thousands of codes now, the new codes have just what's the word for 10 times? I don't know. It's a bunch more.
Yeah. It's a lot.
Right. Because
Right.
the ACA is not now just having doctors bill for the time that they see patients, but for the quality of care, which means there has to be a lot more codes to account for all the different variables involved in the care.
Yeah, basically, there's a code. The ICD-10 or the ICD codes are the diagnosis code. That's what's wrong with the patient. And Patrick's got this up here on here. You can see that there's a diagnosis code here of a 462, which is for pharyngitis. Okay, well, so that's a very generic type of code. But you can also see on there, right next to where it says ICD-9, there's another button there that says ICD-10s. And folks, a lot of people ask us, here at ABS, are you guys ready for ICD-10s? Folks, it's already built in. It's a button there that we already have. So what does this mean to you? Going into 2014, the doctors are going to need to start what's called mapping out their ICD-9 codes to the ICD-10 codes. Being part of ABS, you're going to get access to our system, and you're going to be able to start mapping out these codes for the doctor, maybe even before you start doing their billing. It could be one of the door openers that you can use to get the doctor's business in the first hand. And then as you're getting in there and you say, oh my goodness, doctor, you're using a wrong code here. And again, the system is doing this for you. It's nothing, again, that you have to have gone to school for. It's just you're putting in this code. You're going to click on the ICD-10 code, and it's going to spit out the correct code that you need for that to provide to the doctors. Folks, and again, this is the way that the system works. It's there for those doctors to stay compliant.
Yeah, I think the biggest fear, besides, how do I get my first client? And we address that, of course, on other webinars. But the other fear is how much about all these codes and terminology, and it sounds scary to think, because you may even know somebody who's gone to college or taken some course over the internet that took a year to get through about doing medical billing. Folks, we take people through 1 week, and sometimes have people signing up doctors the following week.
Right.
So it's not brain surgery. That's a pun. It has to do with brain surgery, but that's just one of the codes. No, this is not something that's intricate, folks. It is something that can be learned by anybody. In fact, Eric, when we do our training, and we're about to post our testimonials from last week's training, at the end we ask people to, give us a little blurb about what they thought about the training. You'll see that 9 out of 10 of those people had no background, no clue what medical billing or coding was all about. They don't
Right.
have to, because of the way we teach this, and yet we have them out there signing up doctors. So we kind of figured this out after 20 years, didn't we?
I believe so. Well,
Now,
Patrick,
I see a couple of questions, Eric, that are about, there are things to do with the opportunity and funding for the opportunity and so forth. We don't address those kinds of questions directly on the webinars, folks. Those are things we encourage you to get back with the person who invited you to this webinar, what we refer to as our ABS coaches, and let that person deal with you one-on-one if you're wondering how to pay for it, how to get the paperwork done, and that type of thing. Because we try to make these as informative, as educational as possible, without doing a lot of selling. So we skip over those questions. So if some of you have typed those questions in, see us skipping those, that's why. But any other questions that are there? Hey, we got what, 6 minutes here, Eric? We got finished a little bit early, but
yeah,
shall we tell them about how to get the free
yeah,
mini iPad Mini?
yeah, and how this would certainly come in handy. I mean, not only can you not get started with us here in 2014, you yourself will get the technology to actually show the doctors. You can certainly have access to the internet. Matter of fact, whenever I met with this doctor this last week, we met in a McDonald's, Patrick, and they have internet service. I was
Sure.
clearly able to show the doctor the system right then and there. And so, what better way for you as a brand new licensee getting started in medical billing? Not only do you get the training, the support, everything now, but because of your generosity and wanting to share our celebrating of 20 years, you're actually going to give away an iPad Mini to those licensees that are in part of the January training.
Yeah, we'll be giving that to everybody right there at the training, handing them a brand new iPad mini, because we're going to be teaching specifically at our training going forward how you can utilize that iPad to actually show the doctor aspects of the system itself. And of course, we have PowerPoints and other presentations developed that are for the iPad that you can use to actually show and talk to other people about what you do. So it's a great marketing tool, as well as just being able to check in with your own business from anywhere in the world 24/7 that has an internet connection.
Exactly. So, yeah, folks, if you're looking to get into this next class, it is literally right around the corner. Once we get through the holidays, and I mean, next Wednesday is Christmas, the week after that is New Year's. By the time we start January, the beginning of January, we're just going to be a few weeks out. So, we are going to be open a few days next week, and then in between the Christmas holidays and the New Year's holiday, we're going to be available too. We are already getting people signed up and ready to get in the class here come January the 20th through the 24th. Again, folks, that's just literally right around the corner. You're going to want to start making your flight arrangements to get here. So be sure, if you're looking to get started in this business, this is the one that you want to get into. Now, again, Patrick, you like to kind of sum up the basically the value of this particular training by giving a 100% money back guarantee.
Yes, and I'm going to put that up on the screen so everybody can see exactly what's it's taken right out of the agreement that you'll be signing with us as you become an ABS licensee. Folks, a few years back, we had people asking us about what kind of guarantee do you have? Well, it's hard for any company that sells a business opportunity or a franchise to say, here's exactly how successful you are going to be, because everybody's different, right? So the best thing we knew to come up with is to offer a guarantee that's based on your experience here during the training week. Since we reveal all of our proprietary information about our marketing tools, about our methods, about our proprietary systems, since we reveal all that during the week, we figure if at the end of the week, for some reason, you still don't think that this business is right for you, just ask anybody, any one of my staff members, and we will arrange for you to get a full refund of your license fee. Every penny you paid us will be given back to you. Now, what are you out? Well, you're out whatever it took to get down here. Maybe you have some airline miles to get here, or maybe you had to pay, $300 or $400 to get here. You also have a hotel bill, which will run somewhere around $600-700. We've got a special rate there at the hotel, but let's say $1,000. Let's just round it out. You might invest $1,000 to find out whether this is for real or whether we're just blowing smoke, right? And the only way you'll know is to come through the training. So we tell people, consider that a part of your due diligence. It's the fairest way that I know to show you what we have and let you make the decision at the end of that week. You will know. In fact, Eric, as they'll see from some of the testimonials, they'll know by probably about Wednesday this is either for real or it's not something that they want to stay involved with. Right. So far, we've only had 3 people ask for that money back at the end of the training in 20 years of doing business. I think that speaks volumes for us.
It does. It certainly does. Well, folks, we want you to give us a call here at 866-565-8413. Continue to keep talking with your ABS coach. We're here to help you. We're also here to do some demos for you. We're more than happy to show and share with you those demos. We'll explain to you what we mean by that the system will find the codes. I had spoke with someone not too long ago that were saying, wow, your system actually produces the codes. It truly does, and we can show that to you as well. So give us a call here. We're more than welcome to visit with you, to talk with you, spend as much time as we need to with you individually, and answer all of your questions. Patrick, you got any last closing?
Yeah, here's one. I'm going to squeeze in one more question here that just popped up. Larry says, are there any ongoing royalties after the purchase? No. Larry, we're not a franchise, so there are no ongoing. You never give another penny, you never send another penny to ABS. Once you're a licensee, that's a lifetime license. And Glenn, Glenn's on here. Glenn, thanks for coming. He says, I'm coming in January. Great class. I picked a great class. I got a free mini iPad.
There you go. Well, Patrick, thank you so much. I know that you're getting ready for your holidays and family coming in and visiting with you. So thanks for taking this week out and visiting with us. And we'll do this again the day after.